Good afternoon, everybody. Thank you for coming. So just a bit of run of show. We have a microphone right there in the middle. You can ask 2 questions, and if you have another one, if you go to the end of the line and come back and ask some more. Fire Chief Matt Pegg will address you on the current situation with respect to City of Toronto services and programs, followed by Dr. Eileen Davila, Medical Officer of Health, who will update you on the current situation in Toronto. We have a number of key city division heads here as well. If you have specific questions on city services, we will do our best to answer those questions for you. Okay? All right. Chief Pegg.
Thank you, and good afternoon. As you know, this is the first of what will be daily media briefings as we move forward. We're all aware that the federal and provincial governments just recently announced new information relating to COVID-19. That information has already been fed into the city's Emergency Operations Centre and is being evaluated and actioned as we speak. As you know, last week, the city activated its Emergency Operations Centre. We continue to operate at Level 2 and continue to operate a citywide COVID-19 task force. The EOC is coordinating all aspects of the city's response to the COVID-19 pandemic across all city services to ensure that both the safety and needs of Torontonians remain our top priority. As issues and changes arise, they are readily identified and addressed through the incident management system. First, let me remind everyone of the city services that have not been affected and have not been adjusted or reduced in any way. All emergency services, including police, fire, and paramedic services, are operating as normal. Toronto Water continues to ensure our drinking water is reliable, safe, and remains at the high standard we have come to expect. Garbage collection will continue as scheduled. Road operations, including snow removal services if required, will continue as normal. Toronto Hydro is operating normally, and the TTC is operating normally. There are a number of services, however, that are closed until at least April 5th, including March break camps are closed, city-operated daycares are closed, licensed third-party operated daycare centres in Toronto are strongly encouraged to close. All parks and recreation facilities are closed. City-operated museums and community art centres are closed. Provincial Offences Act court appearances have been suspended. All City Council and committee meetings, public meetings, and public consultations are suspended. All Toronto Public Library branches are closed. The Toronto Zoo is closed. And while garbage collection will continue as scheduled, all scheduled yard waste collection that was set to begin is suspended. As this matter rapidly evolves, the EOC and city operations remain nimble and ready to respond and adjust service levels as required. The decision to adjust, alter, or suspend city services is made in conjunction with the advice and guidance being provided to the city by the respective authorities having jurisdiction. Most commonly, this advice and guidance is coming from Dr. Davila and the Toronto Public Health team. In the event that any further changes to city services are implemented, we will communicate here and provide the updated information online at toronto.ca/COVID-19. Residents and businesses look to the Toronto Public Service in their time of need, and we need to be there to support and serve them. The city, as an employer, is working through processes to ensure that we have the right balance of employees available to service the public in the workplace, while recognizing that we too need to practice social distancing as recommended by Toronto Public Health. At this point, we have asked city employees who are not sick, who have not recently returned from travel outside Canada, and who do not need to self-isolate to continue to report for work. It is important to note that this is a rapidly evolving situation, and we will keep our workforce updated as the situation evolves. We will continue to make decisions in consideration of the advice being provided by Dr. Davila and our Toronto Public Health colleagues. The City is directly connected with community partners, including the United Way and other community organizations across the City, to ensure the most essential services remain available for those who need them most. We are working with the Daily Food Bank and other governments to ensure that those in need are able to continue to access food in a safe manner, even as some food banks are closing. Our public health call centers are experiencing an incredibly high volume of calls. Many of the questions being asked can quickly be addressed by accessing toronto.ca/COVID-19, and I encourage everyone to make this your first point of access. Please do not call 911 when seeking information about COVID-19 or city services. 911 is for use in emergency situations requiring response by Toronto Police, Toronto Paramedics, or Toronto Fire Services only. The City encourages residents with questions they have about city services to visit toronto.ca/COVID-19. This website is being updated continually with key information, including public health information and resources. Please seek information from credible sources only. As I said, the City is working flat out to protect the people of Toronto, and that work will not stop. I know that there are many people who are feeling both anxious and scared. I want you to know that these are normal and healthy responses to a very abnormal situation. The most important thing that each of us can do is to seek out accurate information and to follow the advice and guidance being provided by Dr. Davila and our Toronto Public Health team. The best source for that accurate information and advice is toronto.ca/COVID-19. We are a strong and resilient city, and we will get through this together. Thank you. It's now my pleasure to welcome Dr. Davila.
Thank you, Chief Pegg. Good afternoon and welcome, everyone. I'm here to provide you with an update on COVID-19 plans and my new recommendations. We have recently seen a significant increase in cases of COVID-19, some of which are unlinked and thus indicate community transmission. We continue to pursue rigorous investigations of these cases and their contacts. Last week, I made a number of recommendations on public health measures to protect our city. At this time, I am urging you to take further action. I recognize that these recommendations will result in significant adjustments to our daily lives, and they will present challenges. Please know that I do not make these recommendations lightly. On the contrary, they are being made after careful and measured consideration. Today, I recommend that bars and restaurants stop in-person dine-in service and move exclusively to takeout and delivery service as soon as possible and no later than midnight tonight. In order to limit the spread of COVID-19, I am also strongly recommending that all nightclubs, movie theaters, and concert venues close as soon as possible. Businesses who choose to defy these recommendations may be subject to orders under the Health Protection and Promotion Act. Also, I am recommending, if you can stay home, do. If you are a business or an employer, help your staff to stay home. Limit group gatherings. If you need to seek medical attention, call ahead. If you are a healthcare worker and you are sick, stay home. If you have traveled, stay home for 14 days from the day you arrived back from your travel. If neighbors or family members need supplies, then please help them, but practice social distancing. If you need to take public transit to access health services or to acquire necessary goods or products, practice social distancing. I am calling on our city to rise to this challenge to reduce the spread of this virus. We know that these measures that I'm recommending today work based on the experiences of other jurisdictions. I am asking for everyone in our city to take these recommendations seriously and make every possible effort to practice social distancing. I cannot overemphasize how important this is, particularly at this critical time. Again, this is not a decision that I make lightly. Our hospitality industry contributes significantly to the life of our city. We are taking this action today to protect the health of our city. I've been asked why I do not issue blanket closures for today. And simply, it is the job of public health to balance measures meant to control the spread of COVID-19 with the economic consequences of those measures, with the overall goal of protecting and promoting the health of our city. I know our mayor and our city manager have this front of mind and have convened the mayor's economic support and recovery task force. We in public health, along with our residents, we all have a role to play in preventing further spread of COVID-19. This is why I need each and every one of you to do your part for the well-being of our city. Every opportunity to avoid interactions with others helps to prevent the spread of disease. Every interaction avoided helps to flatten the curve. If you can, stay home. Help out our city by reducing your interaction with others. Every little bit, every effort counts. In closing, I would like to sincerely thank my city colleagues and the entire Toronto Public Service, and in particular, my team at Toronto Public Health. Your city is still working. Many people are working around the clock. We love this city too. I'd also like to thank the members of the media and the people of Toronto for your willingness to help out, whether it's by sharing accurate information or by staying home. These decisions are not easy. We will get through this, and we need your help. So with that, I will wrap up my remarks and will be happy to take any questions you may have.
Dr. Davila, about the community spread, how many cases, how far has it gone? Is there anything you can say to shed some light on that?
Well, you know, through previous question and answer periods, I don't discuss the details of individual cases. At last conversation with the team back at Toronto Public Health, I do know of 3 cases for which links could not be found. However, there are still investigations ongoing, as I indicated in my remarks.
And follow up to Chief Pegg, if we're starting to see community spread now, we're not moving up to level 3. Can you explain why not? What would have to happen before we get to a level 3 emergency status?
So the decision to escalate from a level 2 EOC operation to a level 3 EOC operation is not necessarily tied directly to external circumstances. It would be a judgment call within the EOC and within our command structure based largely on whether or not we possess the resources and the capability to continue to manage the situation and the incident effectively. And I can tell you that the processes that are in place, both within the EOC and now with an offsite, we've actually split the EOC from the COVID-19 task force. They're working in 2 separate locations. Both of those functions are happening. They're well coordinated. The city is nimble and accurately and effectively responding to the circumstance. And my observation and assessment and recommendation is that we're adequately served at level 2, and unless and until that changes, I wouldn't recommend moving to 3.
Hi, for Dr. Davila. If you believe that community transmission is happening now, is there a marker that you're looking for down the line that would prompt you to bring about some more widespread cancellations, suspensions, closures of businesses? What's the next thing that needs to happen?
Well, you know, the next thing that needs to happen will depend on how the disease and the outbreak evolves in and of itself. As you can see, we've put in a number of public health measures in place to try to limit interactions between individuals, and we do know that social distancing and effective social distancing is what makes a difference. We've seen this in other jurisdictions, and we have every reason to believe that that should be effective here as well.
And to any businesses that might still be open after midnight tonight, anything more that you would say to them in terms of people who are worried about how they can get by? What would you say to those business owners? So
with respect to business owners, we're encouraging them, as they are both employers and members of our community, to help out in our effort. We know that increasing social distancing is a key component to preventing the kind of circumstances that we're seeing in other jurisdictions who unfortunately applied those measures at a later point in their outbreak. So I would encourage their compliance with the recommendations that we've made at this time in order to limit the impact of COVID-19, both on the health of our population in terms of virus spread and beyond.
Just wondering if you could shed some light on how businesses will be, other than this, notified about these closures and how you plan on surveying them after 12 o'clock this morning or tomorrow morning.
So with respect to communications, I may turn that over to my colleagues. And when it comes to understanding what is happening out in the city, what's happening in the various businesses, we do find that people do help inform us. We will manage things on a complaint basis. But again, I would call upon business owners in our community as members of our community to comply with these social distancing measures that we're putting in place in order to limit the impact of COVID-19 on our city and its health.
Yesterday, Ottawa's medical officer of health said because of those unlinked cases, the community spread, that there could be upwards of like 1,000 cases in the community that they don't even know about. Are you able to say what you think may actually be out there in Toronto?
I think that those kinds of estimates are premised on models and which have yet to be tested. I think what we can say is that we have some evidence of community transmission, and what is known, what is patently clear, is that effective application of social distancing measures makes a difference in terms of changing the trajectory of the outbreak. And flattening that curve. That's why it's so important that we engage in these measures.
If If I could just follow up, what model are you currently looking at for a potential infection rate here in Toronto?
There isn't a singular model. We're using several different sources of information, and in fact, there are a number of modeling groups out there who have different mathematical models by which to try to predict and understand what might be happening in the community. And it's not clear that one is the right one. So we use all the different points of information that we can to inform our decisions.
At this point, are any of the COVID-19 patients in Toronto in hospital, or are they all self-isolating?
So at last check, I believe we have 4 individuals who are in hospital.
Is that in a sort of observation scenario or in an intensive care sort of scenario?
Again, I don't speak to the specific details of cases out of concern for the privacy of those individuals, but I can say that we have 4 that, when I last checked with our team, that 4 unfortunately are hospitalized as a result of their COVID-19 infection.
And with the community spread investigation, if you find an event or a place where people were, would public health be then informing other people who might have been there or publicly making it known where you think this might have been transferred?
Well, this is our standard practice with respect to infectious disease case and contact management, and so we're continuing to do that at this stage of the game.
Some of these questions will be about Toronto, but obviously it's a province-wide picture. We've been stuck at that number of 5 resolved cases for a very, very long time now, and I'm wondering if you have any insight about why we seem to not be able to clear those, the vast majority of our cases.
Well, I think there are a number of different reasons. For some, it may take some time to clear evidence of the virus. And what's interesting is that presence of the virus doesn't mean that it's actually viable virus, nor does it mean that somebody is infectious. So that's first and foremost. I think the other element, of course, is that at a certain point, when you get to a certain number of cases, it becomes more of an academic exercise to clear people. So it no longer becomes part and parcel of the case management of COVID-19 to clear people with testing after they've become sick.
This might be a question for you, or might be a question for Chief Pegg, but you talked about the consequences that people may, or the restaurants and bars may face if they stay open past midnight. Can you be more quantitative about whether they're fines, whether there's some other kind of penalty that they would face?
So with respect to, I did speak about the possibility of orders under the Health Protection and Promotion Act. And under that act, if one is found guilty of an offense under that act, a fine may be applied, and it may be as high as $25,000 per day.
One question for Dr. Davila, another for the city manager. Dr. Davila, can you say, we know now there's what looks like community transmission. From the types of cases we're seeing here, is there anything else you can conclude about the ages of the people or any other trends? Because everybody's trying to look at the global picture. Is there anything you can say about the Toronto cases?
Well, I think what we have seen until very recently is that the vast majority of our cases, actually that still is the case, the vast majority of our cases are linked to travel outside of Canada. Hence, we still have some measures specifically in place in respect of those returning from travel outside of Canada. Unlinked cases and evidence or early indicators of community transmission are relatively new for us. So I think those are the most salient features looking at our data at this stage of the game.
And spread across the city, there's no geographic kind of hotspot for them or anything like that?
Not to my knowledge.
Okay. And for the city manager, just ask, there is some concerns among city staff that a lot of them are being asked to come to work when the city seems to be telling people generally to work from home. Can you address that issue, please?
Sure. So a number of questions have been raised by staff over the last few days, and so we've been taking all of those questions and providing answers, which we are now deploying through our website, as well as we're creating a staff hotline, as well as we're going to be using the cloud for those people that don't have access to a city computer. So answers to that question are going to be provided in multiple ways. In terms of, we're following the general principle that the Dr. Davila has set out, and that if possible, where possible, to work from home. So there are certainly some people that are going to be able to take advantage of that. But, you know, the difference, I guess, in terms of government compared to, say, our private business, I mean, we are required to staff essential services. We're also expected to deliver a number of core services. So we want to be able to respect the direction of the doctor, but at the same time maintain services for everyone here. We would not bring anyone into the city to work here if it wasn't safe. So, I mean, there's no issue in terms of that being a concern really for any of us that are here today or anyone else that we would like to see work here on a day-by-day basis. So, but the principle I think the doctor has communicated, as well as the mayor, I think is a good one. It's one that we respect, and so wherever possible, we are going to afford some percentage of our workforce the ability to work from home.
Dr. Davila, we've asked before about what can be done with the TTC. Now we've got evidence of these 3 cases of community spread. Is it now time to bring in some sort of crowd control or limitation on the subways, streetcars, and buses?
So I think when we take together all the public health measures that have been put into place, you'll see that what we're trying to do is increase social distancing, and that includes on public transit. So if people who can stay home do stay home, then that's one less, that creates for less volume in respect of public transit, thereby allowing it to be available for those who need that service, whether it's to get to work that they must provide because they're engaged in healthcare or in the provision of groceries, for example, or pharmacies. We know that there are some services and goods that we will all need in order to maintain, life in the city. So to the extent that people are actually able to engage in those maximizing and social distancing measures, we know that we will create the circumstances on public transit that allow it to continue to run and to do so in as safe a manner as possible.
And given that, granted that the commuting crowds today were obviously smaller, people are staying home more, but still crowds on the subways are crowds on the subways. Social distancing may not be possible in rush hour when you're crammed shoulder to shoulder.
So again, you're quite right, and I would say that that's within the context of your standard rush hour. What we have asked is of businesses and employers to consider how they might reduce that load and spread out, say, for example, the volume of people who might need to use public transit at particular times of day. So as I mentioned earlier, if people who can stay home do stay home, that by definition reduces the volume. If businesses and employers can adjust work times, that certainly would help reduce volume. And we would encourage people, individuals who are riding on public transit, to observe and see what opportunities there are for them to perhaps get on, a less busy car, or to try to flex their time in accordance with less busy hours on the TTC. So I think taken all together, the measures can provide for public transit to continue to operate safely, particularly for those who need to use that as their method of travel.
You've seen a number of stores over the past few days say they would be closing their doors for the safety of their employees and the public. Shopping malls are still open, albeit on reduced hours, but they are still gathering places. If you walk over to the Eaton Centre, there's a couple hundred people in there right now. What is your advice to shopping malls?
So I think, again, my advice to shopping malls is the same advice that I'm providing to the entire city of Toronto. I'm asking everybody to participate in our efforts to increase social distancing. So we recognize that people do need to have access to goods and services as part of their daily lives. And when we think about the basic interactions that are required, say, for example, to purchase necessary goods, those are relatively short-lived interactions. So with the combination of maximizing social distancing, minimizing time, staying home when you can, not going out to purchase things unless they're necessary, unless they're essential, then I think we can create circumstances that allow for life to continue while at the same time creating an environment that reduces the likelihood of COVID-19 spread.
Thank you, everybody. So we will do this daily at 3:45 in this location. We'll issue a media advisory every morning just to confirm. But thank you all for coming, and we will see you tomorrow.